S-287 is a bill that will expedite treatment and involuntary medication for patients in the hospital. Currently, patients can wait as long as 7 to 10 weeks if they refuse medication before their clinicians are able to prescribe medication for them. The bill is consistent with the VMS policy that was adopted at the Council in early February, and if it is passed, it will allow the courts to order an expedited hearing and have a decision for patients within 7 to 10 days, and allow their treatment to go forward. These expedited reviews would only be available to certain patients who have either had involuntary medication before and benefited from it, or patients who are at serious risk of causing harm to themselves or others even while they're in the hospital on the unit. VMS thanks VOS for their leadership and hard work on this bill.
A bill that would prohibit the use of electronic handheld devices was passed in the House last week. The VMS testified on behalf of its members from a 2011 resolution that urged the Vermont General Assembly to pass such a ban. We will continue to testify in the Senate this week and will follow this bill. We know that the Senate is a rougher path than the House. The House passed it pretty well with a large margin, but the Senate may be a little more difficult. And we know that also the governor isn't supportive of this bill, but the General Assembly seems to be mostly supportive, so we're hoping that that will pass the Senate.
S-295, a bill that initially was aimed at preventing and treating drug abuse for individuals who are involved in the criminal justice system, has been expanded to address diversion of buprenorphine. As voted out of the Senate Judiciary Committee, S-295 would require the Department of Health to create a list of prescribers of buprenorphine. To be added to the list, prescribers would have to have a DEA, a special DEA number, and a waiver from SAMHSA, the Substance Abuse and Mental Health Administration, a federal agency. These are requirements that are already existing in federal law. VMS has been following and commenting on this bill and wants to ensure that any administrative requirements added in the bill don't deter physicians from participating in this program and don't result in decreasing access for patients to this important medication-assisted treatment.